Hi, I'm Jane Morton. I'm back with Section 3 of Welcome to Medicare, and I work for the Agency on Aging, and we'll just get right to it. The Western Montana Area 6 Agency on Aging serves Lake, Lincoln, Mineral, and Sanders counties. We are at 110 Main Suite 5, Polson, Montana, 59860. You can call us locally, 406-883-7284, or toll free, 1-800-555-3191. I'm a SHIP counselor. The Montana SHIP program, or State Health Insurance Assistance Program, trains people to serve as counselors to Medicare beneficiaries, either people just starting Medicare or people on Medicare who need some assistance sorting some things out. We have 4 SHIP counselors available in the Polson office. Plus, we also have SHIP counselors in Lincoln, Mineral, and Sanders counties we can direct you to. Also, with Medicare questions, you can call the Social Security office in Missoula or Kalispell, and their phone numbers are shown here. The first 2 sections of Welcome to Medicare, I've talked about the original Medicare. That's this side here. Original Medicare, you can get Part A and Part B. Then you can get Part D for drug coverage and get a Medigap plan to supplement your original Medicare. There's another option called Medicare Advantage Plan. I want to call your attention to this word "or" here, because you don't cherry pick from this side and this side. You either go with original Medicare or you go with a Medicare Advantage plan, one or the other. Now let me just briefly explain how Medicare Advantage works. If you sign up for a Medicare Advantage plan, you still have Medicare. You still have Part A and Part B. You're still in Medicare. You still have all the rights and all the protections that come with belonging to Medicare. For that reason, you still have to pay your Part B premium, $144.60 a month, to Medicare. Then, instead of your medical bills going to Medicare, your medical bills are going to go to your Medicare Advantage company. Medicare pays them a chunk of money for your benefits, and they manage it. They pay your bills. They pay for your prescriptions. You pay whatever their premium is that they set, and we'll look at some of those options in just a little bit, and your Part D prescription coverage is included. And then, because they're managing your benefits and they're paying your bills, they set up their own structure of copays, and we'll look at that in detail a little bit later. They also have a maximum out-of-pocket, and we'll talk about that later too. This just kind of restates what I just said. I don't know how that got on there. It combines Parts A and B and Part D, the prescription coverage, if you choose, in a private insurance policy that's not just approved by Medicare, it actually is under contract with Medicare. So they have to toe the line or Medicare dings them for it. So you still pay your Part B premium. Your healthcare coverage is equivalent to original Part A and Part B. It's just handled in a little different way because the bills go to the Advantage plan and they have their own copay structure. And then, like I said, you don't go one side or the other. You pick one or the other. You're not allowed to purchase a Medigap plan or supplemental Medicare insurance. As a matter of fact, it's against the law. If someone knows you have a Medicare plan, it's against the law for them to sell you a Medicare Advantage plan unless you intend to drop your Medicare plan. If you have a Medicare Advantage plan, it's against the law for them to sell you a supplemental plan unless you are fully informed and intend to drop your Medicare Advantage plan, because you can't have two at the same time. The way it works is once you get a Medigap plan, your supplemental plan won't pay any money. They'll still take your premiums if you keep mailing them to them, but they don't pay anything. Okay, the Medicare Advantage plans have a structured copay system and deductibles. They may have additional benefits like vision, dental, and hearing. It's usually a limited amount of coverage, more in the line of yearly exams or cleanings or x-rays or checkups. Part C Medicare Advantage usually has a monthly premium, and I'll show you the exception to that. Then there are PPOs and HMOs. PPOs are preferred provider organizations. Now they have a network of providers. That's a network of providers that have a contract with them. And they pay in the network best, but they also pay out of the network. HMOs only pay their network providers. If you go outside of the network of the HMO, they don't pay at all. And we'll look at that in more detail in this next slide. This is the comparison sheet that shows for Lake County. These are the Medicare Advantage plans that are available for people that live in Lake County. Every year the insurance companies get to decide what counties they want to offer policies and what plans they want to offer within those counties. And only 2 companies offer Advantage plans in Lake County. Blue Cross offers 2 plans and Humana offers 2 plans. Now these first 3 listed here are preferred provider organizations. That means that they pay in their network or out of their network. Let's just use this one for an example. If you go to a doctor and you have a Blue Cross Classic Advantage plan, you pay $15 in network. If you go to a doctor that's not in their network, you pay 50% and they pay 50%. For all of their services, there's a set copay, unless it's a percentage like x-rays, a set dollar amount that you pay. Out of network, it's almost always a co-insurance of 50%. You can see it's 50% for just about everything. You pay half, they pay half. And obviously, they pay more if you stay within their network. Let's go down on this same plan to hospitalization. If you go to a network hospital, an in-network hospital, for days 1 through 5, you pay $360 a day. If you're there longer than 5 days, for days 6 through 90, you don't pay anything. That's if you go to an in-network hospital. If you go to an out-of-network hospital, you pay half the hospital bill, they pay half the hospital bill. Now, as I said, these 3 are PPOs. They pay in-network or out-of-network. This other Humana plan here, Humana Gold Plus, is an HMO. They only pay in-network. So, and their copays are pretty attractive. You just have to remember you have to stay within their network. If you go outside of their network, they don't pay at all. It's all going to come out of your pocket. And you may think, well, Humana, that's nationwide. I'll never be out of their network. Even as a SHIP counselor, I didn't really realize until about 2 years ago that Advantage networks are not quite the same. The Humana Advantage network covers Missoula and Kalispell and pretty much everything in between. If you go to Spokane or Billings, you're out of their network. Same thing with Blue Cross. The Blue Cross Advantage network is pretty much local from Missoula to Kalispell. Anything else is probably going to be out of their network. There are also a couple of other plans shown here. This Humana Choice plan looks kind of attractive. It's a zero premium plan, but it does not have any drug coverage, and you can't add drug coverage to it. So this is good for people that have their own drug coverage, say VA drug coverage or Indian Health Service drug coverage. But for most people, this is no good. Then this one is completely different. This is a Medicare savings account offered by a company called Lasso. And it doesn't have a monthly premium either. They take some of that chunk of money they get from Medicare and they put it in a Medicare savings account for you, and you use that to pay your medical bills. Sorry. The trouble is, their deductible is $7,400. So they don't pay until you've spent that much. If you spend everything in your Medicare savings account for the year, you still have to spend about $4,000 out of your pocket to meet this deductible before they pay anything. But then after that, they pay everything. So that's a whole different deal. But if you're interested, we can give you some more information, and you have to contact them. We can sign you up for any of these on that Medicare.gov plan finder. We can't sign you up for a Medicare savings account, but we can give you the contact information for the Lasso company. Oh, before we go on, I want to talk about the maximum out-of-pocket. Say something catastrophic happens to you, open heart surgery or a terrible car wreck where you have to have all kinds of things done to put you back together again. The maximum out-of-pocket, again, we'll go back to this plan just because it's the first one here. The maximum out-of-pocket for Blue Cross Classic is $6,700. Now, if you got in a terrible wreck and your hospital and doctor bills were going in the hundreds of thousands, you would only be liable for $6,700. Once you met that maximum out-of-pocket, they would pay everything 100%. This can really save your bacon. I know it did for us one year. It wasn't Medicare, but it was maximum out-of-pocket situation. When my husband had to have open heart surgery, we wouldn't have been able to send our kids to college like we planned if we hadn't had insurance with a maximum out-of-pocket. So we had to come up with quite a bit that we had planned on, and we didn't have to clean out our savings and everything just to pay his doctor bills. And you can see that all of these have a maximum out-of-pocket. Now, that's the in-network. If you go out of their network, the maximum out-of-pocket is $10,000. So it jumps up. And you'll see that on just about all of them, the maximum out-of-pocket for out-of-network is $10,000. The maximum out-of-pocket for this HMO plan is $4,900. But there is no maximum out-of-pocket out-of-network because it all comes out of your pocket anyway, out-of-network with an HMO. What's new in Medicare, it seems like every year they add a little bit, a new preventative service. Preventative services are covered 100%. Some of the newest preventative services are screening and counseling for depression, alcohol misuse, cardiovascular disease, obesity. What else is new? The donut hole is pretty much closed. You might have heard some horror stories about the donut hole. If people had really expensive meds, once a certain amount of money had been spent by the insurance company and by them, I'm all screwed up, I'm sorry. We should just